How do RPM reimbursement codes work for remote patient monitoring? Imagine being able to keep an eye on a patient's health without them leaving their home. That's what remote patient monitoring is all about. Now, how do healthcare providers get paid for the service? That's where reimbursement codes come into play. These codes are part of the current procedural terminology system, which is used to both Medicare, Medicaid, and private insurers. They help ensure providers are paid properly for their work in remote monitoring. The main codes used for remote patient monitoring are CPT 99453, CPT 99454, CPT 99457, and CPT 99458. CPT 99453 covers the initial setup of the monitoring device and patient education. It's a one-time fee, and it's billed once per care episode. The device must be used for at least 16 days within a 30-day period to qualify. CPT 99454 is a monthly code that covers leasing or supplying the device, plus the collection and transmission of data like blood pressure or oxygen levels. Again, the device needs to be used for at least 16 days in a month for billing. CPT 99457 is for the time healthcare professionals spend in real-time, interactive communication with the patient or caregiver. This involves discussing the data collected and managing the patient's care. It covers the first 20 minutes of such contact each month. If the provider spends more than 20 minutes, CPT 99458 is used as an add-on for each additional 20-minute block. These codes help providers bill for both the device and the time they spend managing the patient remotely. To bill these codes correctly, certain rules must be followed. The service must be ordered by a qualified healthcare professional, like a doctor. The patient should already be under the provider's care, and the device must be FDA cleared for home use. Data collection needs to happen for at least 16 days within a 30-day period. For the interactive communication codes, the contact must be live and involve audio communication. Using these codes makes it easier for providers to include remote patient monitoring as part of regular care. It encourages the use of telehealth platforms that can collect, transmit, and review patient data efficiently. This setup benefits patients by allowing continuous health monitoring and timely interventions, especially for chronic conditions. It also supports mental health teletherapy by providing ongoing data that can inform treatment. Setting up a telehealth appointment with RPM involves ordering the right devices, teaching patients how to use them, and scheduling regular virtual check-ins. During these check-ins, providers review the data, discuss any concerns, and adjust treatment plans as needed. Proper documentation of each step and adherence to billing rules ensure providers get paid for their services. Overall, understanding how these reimbursement codes work helps make remote patient monitoring a sustainable and effective part of telehealth care.